Hi everyone, this is Pharmacy or Darren Coggins. Just wanted to talk to you today about some over-the-counter medications that I suggest that you have at home while this whole COVID-19 thing happens. These are just some recommendations, not saying that if you have these symptoms you have the disease, but they're good things to have on hand. So let's get started. So I first want to talk about COVID-19 and what causes it, and then we'll go into the symptoms and how we can deal with those symptoms. So the first thing I want to let you know is the virus that actually causes COVID-19 is called SARS-CoV-2, or Severe Acute Respiratory Syndrome Coronavirus 2. So that's the name of the virus that causes the disease, which is COVID-19 or Coronavirus Disease 2019. The signs and symptoms of that coronavirus include fever, dry cough, and shortness of breath. So we're going to talk about each of those symptoms and what possible medications we have over the counter and some that we don't to help treat those conditions. So first off, outlining what a fever is. So a normal temperature for anybody is about 98.6 degrees Fahrenheit. CDC considers a person to have a fever when he or she has a measured temperature of 100.4 degrees Fahrenheit or greater. Fevers are typically the first sign to indicate a possible infection in someone. It is your body's natural defense to raise your body temperature to kill any pathogen. It also stimulates an immune response to also help fight that foreign pathogen inside your body. So first medication I want to talk about is Tylenol or acetaminophen. It has antipyretic or anti-fever effects. Those affect via direct action on the hypothalamic heat regulating center, which is in your brain. So the adult dosing looks like this. There's regular strength tablets, extra strength tablets. There's also arthritic strength tablets, but I don't recommend those for fever. So the 325 is 2 tablets by mouth every 4 to 6 hours. The 500 are 2 tablets by mouth every 6 hours. It's important to note this max dosing here. It's 4,000 milligrams if the doctor is prescribing you those medications, and it's 3,000 if you're just trying to self-treat because you don't want to overdose. Too much Tylenol can lead to the effects down at the bottom, which include nausea and rash. That's with any dose really, but the hepatotoxicity has more to do with overdosing. The Tylenol is metabolized in the liver, and so it can have some damaging effects if there's too much going on there. So just wanted to throw that little tidbit in there. Next we have Aleve, which is naproxen. It's in this class of medications called NSAIDs, or non-steroidal anti-inflammatory drugs. It's very similar to ibuprofen, aspirin, indomethacin, things of that nature. It works by inhibiting cyclooxygenase, which reduces prostaglandin and thromboxane synthesis, which have to do with the immune response and fever production, and also a little bit of effects on blood. The adult dosing for this medication is 1 tablet every 12 hours, not to exceed 2 tablets in a 24-hour period. Some common side effects that occur with this are dyspepsia, which is indigestion, nausea, abdominal pain, constipation, fluid retention. Some of those are if you take them for long term, but more severe side effects are GI bleeding or gastrointestinal bleeding, nephrotoxicity, which has to do with your kidneys, hypertension, or congestive heart failure. If you have any of those conditions listed in the severe section, I recommend you not take Aleve or any other NSAID for that matter. So there is some controversy with regards to COVID-19 by taking NSAIDs. Specifically, it has to deal with ibuprofen. There was a study, I believe, out of France. It was either France or Italy, stating that the ibuprofen could make things worse, but there's no clinical trials or other scientific data to suggest that or even prove that. There's contradicting literature out there also that says that NSAIDs can help in the instance because they have anti-inflammatory effects, but again, it's just there's too many unknowns to be for sure. I prefer naproxen in this instance. One, it has the anti-inflammatory effects because a lot of people get inflammation when they get sick, or just in general. And there are studies that do show that naproxen has been shown to have antiviral activity. And it also has a way that it can bind in certain instances on certain viruses, including SARS, to make the disease lessen. So that's why I'm talking about Aleve, not necessarily ibuprofen, which a lot more people are familiar with. But that's the controversy that's going on right now. So if you just want to take Tylenol, if you're not really sure, I totally understand. That it's perfectly fine. Just remember those max dosings. I would just reiterate that if you have liver issues, not to take any Tylenol. If you have any kidney issues, not to take any NSAIDs. So the next symptom we'll talk about is dry cough, which is a non-productive cough. It's caused by irritation or medication such as lisinopril or any of the other ACE inhibitors. But there are over-the-counter products that we can use to treat the dry cough. Specifically, I prefer Delsym. Delsym is a dextromethorphan. It's in a 12-hour formula. There's also Robitussin, but you just have to get dosed more often, but it is basically the same thing as far as the dextromethorphan is concerned. They suppress the medullary cough center, which suppresses your coughing. It's good to suppress a dry cough, not necessarily a wet cough. If you have any questions about that, please comment below. So the dosing for the Delsym is 10 mils every 12 hours. I like it, it's twice a day. So 20 mils in a 24-hour period. The listed adverse effects include nausea, dizziness, abdominal pain, drowsiness, and fatigue. Primarily the drowsiness and fatigue are what I warn patients about, especially if they're taking any other medications that also cause drowsiness and fatigue. Putting those two products together, or two or three, increases the sedation effect and can increase to falling, which can increase to more injury. So I just want to make people aware of that if they are considering a cough suppressant such as Delsym, or any cough suppressant for that matter, if they are on other medications that do cause them to fall asleep or become drowsy. Finally, we'll talk about shortness of breath. Obviously, shortness of breath can occur in the severe acute respiratory syndrome, because that's what we're talking about right now. Asthma is another common way shortness of breath comes up, also in chronic obstructive pulmonary disease, or COPD. So the signs and symptoms include difficulty breathing, chest tightness, wheezing, fast shallow breaths, and cold and clammy skin. Unfortunately, there are no over-the-counter medication products to treat shortness of breath. They're primarily prescription only. There was a product on the market that was called Primatene Mist that was used to help with asthmatic symptoms. However, I know they tried to reformulate it. It was taken off the market, they reformulated, they tried to put it back on the market. I have not seen it back on the market, but that's not to say that it's not out there. If anybody knows anything, please comment below and let me know what you know. But I do know we have plenty of prescription products to help treat shortness of breath. So those include beta-2 agonists, anticholinergics, and steroids. Now, these are not a list of all the medications that are out there, but these are the common ones I see on a day-to-day basis. They do come in many dosage forms. They come in inhalation solutions that are released via nebulizer. They come in inhalers. Some even come in tablets and capsules, and some, like albuterol, come in a liquid form. So there's various ways that you can actually get these medications. But like I said, they're typically used in asthma and COPD patients. Right now, because there are so many people with asthma or COPD, and now with the COVID-19, they are in short supply. Specifically, the rescue inhalers are in short supply. We're having trouble getting them every day. We're checking our wholesalers all the time, trying to get more in. That has caused some brand generic disputes. Most insurances want to pay for the generic because it's a cheaper medication, but all we have available is the brand, so we're dealing with the insurance in that instance. And unfortunately, some of these products are brand name only, and they require prior authorization because they're not on insurance. They're either not on their formulary, or they're just too high of a tier, and they want the patient to try other things first. So that is also a barrier that we're trying to deal with while we're dealing with this crisis that we're in. So just to sum up, some list of medications to have on hand during this crisis, and really just to have on hand anytime you get sick, because fever and shortness of breath, coughing, they can occur with many different types of disease states. So like I said, Tylenol is good for fever and pain. Aleve is good for fever and pain also. Aleve, like I said, is an anti-inflammatory medication, so if you have inflammation associated with it, it's a good idea to use that versus Tylenol. Again, if you're more on the side of the controversy that ibuprofen worsens the condition, by all means, please take Tylenol. The only caveat I have is if you have any liver disease or liver dysfunction, do not take Tylenol. And on the same side, if you have any kidney issues or gastrointestinal stomach issues, do not take Aleve. Delsum, again, is for cough, dry cough, or wet cough. We're talking about dry cough here, but Delsum, twice a day dosing versus Robitussin, which could be up to 4 times a day, depending on how often you do it. And then finally, if you do have asthma or COPD, you are at a higher risk of contracting COVID-19 just from the fact of the nature of the disease, because it is a respiratory disease. It's a good idea to just make sure that you have everything up to date. Make sure that you have refills on your prescriptions. Make sure that your prescriptions are not expired. Have those rescue inhalers handy. Because like I said, we are having problems in those distributions right now. Not saying that we're completely out of them, so don't rush and try to get a 3-month supply and hoard them like all the toilet paper and things were happening. But what I am saying is just make sure that you have refills on those prescriptions, so when you do need them, we can fill them. So that's all I have for today. I know that was a lot, and I was hoping to shorten it, but it's a lot of information to talk about. I'm planning on doing some more videos regarding the COVID-19, so if you have any questions, comments, concerns, please comment below. Also, if you want to stay up to date with COVID-19 on things you can do during this crisis, please subscribe, and I will try to get as many videos as I can. But I'm fighting the front lines right now, so just be patient with your pharmacist right now in this time of need. In this crisis, and also your other healthcare workers and all other essential personnel. So thanks you guys for watching, and stay safe.